What's the difference between chronic low back pain and acute low back pain?
Right, so it's really a time course, right? So you have acute, which means pain's been going on for less than 4 weeks, and then you have chronic, and the pain's been going on for greater than 12 weeks. That's really what tells us between acute and chronic. Acute pain is something that we'll mostly likely experience, whether we're overdoing it, moving some furniture, things like that. We'll all experience a little bit of acute pain, but in generally that should resolve within a couple weeks. Chronic pain is unfortunately on the rise, as we talked about earlier, and that's the kind of problem that we have, and that's the pain that lasts greater than 12 weeks, and in general more than 4 days per week.
So what's that pain you have if you have it just in the morning? A lot of people just wake up with that stiff back. What is that? Just
Right, so you have a couple different types of stiffness in the morning. So if you get up and you're having a little bit of stiffness in your middle age or later in life, then that can be osteoarthritis. You can think of osteoarthritis or just kind of regular arthritis as kind of a rusty hinge. You kind of have to get up, move around, and it kind of improves. That stiffness is kind of less than 30 minutes. If you get up and you're younger or middle age and you have stiffness that's lasting hours and hours, that's something we really need to investigate, and that could be an inflammatory condition.
okay. And what about the mattress? How big of a role does that play?
Plays a big role. It's important.
Okay.
I get that question a lot. Should I spend this much money on a mattress? I spent the most money on a mattress in my life. In general, for back pain, if you have no back pain, you can sleep in whatever position you want. We've been doing it for all of human society, right? But if you have back pain, you're in modern society, you want to kind of have a high coil spring mattress, kind of a firm mattress.
Okay.
And the preferred sleeping position is on your back. So on your back, and many of us don't do that. In the United States, the predominant sleeping position is either on one side or the other, sleeping on your sides. If you're going to do that, just take a pillow between the knees and just maintain a neutral spine. Neutral spine means your head is between your shoulders, your ears are on top of your shoulders and kind of over your hips, and that your knees are not crossing. So that's kind of the best position.
So a firm mattress. So what about those, I don't want to say brand name, Tempur-Pedic, but if those really mushy, like that conform to your body and they're super expensive?
Generally, the softer mattresses, if you have no back problems, are fine. If you have a back problem, I would suggest a firm mattress.